Good morning and welcome to Reopening Connecticut Arts Venues Science-Based Safety. I'm Eric Dillner, the CEO of the Shoreline Arts Alliance and the chair of this task force. The goal of our task force is to offer you the opportunity to reopen your arts venue from a public health perspective, provide a listening and sharing platform, and to help build consumer confidence through science. We are thrilled by your interest in opening safely. Last meeting, we had over 550 people in attendance, and since then, over 2,200 views of the broadcast. Most importantly, though, we gathered questions from you. We took great care to review each one of your questions, over 100, and have developed a strategy to answer them over the next several webinars. Today, we will focus on risk reduction planning and air handling, and then move into many of those questions. Please use the Zoom Q&A and Facebook for asking your questions, and reserve the chat for resource sharing. Just a glimpse at what is next. We have added a session on June 24th at 10 a.m. to take a deeper dive into many of your questions related to artist safety in the studio, backstage, and so much more. The focus will be further developed from the questions you ask us today, so please send them in to us anytime. Toward the end of the month, Sten and I will begin site visits to various venues throughout New England, and then come back to you to show you examples of challenges and how you might address them specifically in your venue, answering many of the questions we have already received. Again, we are here for you to help you look through the lens of public health. The Dean of Public Health and his team are extraordinarily generous with their time. We ask that you respect their time by sending your questions and needs through the task force members. Their contact information will be shared in the chat. So let's meet those folks who are so generous in helping us to reopen Connecticut's arts venues and to keep us safe. It's with great pleasure I introduce you my co-chair, Sten Vermund. Sten is Dean of the Yale School of Public Health and holds the Anna M.R. Lauder Chair in Public Health, as well as a secondary appointment in pediatrics in the Yale School of Medicine. As an infectious disease epidemiologist, Sten's research had to pivot quickly, as with so many others at Yale, to focus on the COVID-19 emergency. Sten and his wife are deeply fond of Connecticut's cultural arts, and he is pleased to offer his counsel to local arts organizations. Today, we also have Sten's colleague, Krystal Pollitt. Krystal is an assistant professor in the Department of Environmental Health Sciences of the Yale School of Public Health. She also holds an appointment in the School of Engineering and Applied Science. Her research is focused on understanding our exposure to environmental factors and the impact on health. Krystal is particularly interested in chemical and biological exposures in indoor spaces. She's perfect for what our questions are today. Thank you both for helping us make our huge decisions. Krystal, let's begin today by clarifying the basic routes of transmission of this virus. Krystal?
Hi, thanks, Eric. So we've had some really fantastic discussions so far about guidelines on person-to-person contacts, and also transmission primarily through respiratory droplets. So these are when someone sneezes or coughs. And we know when this happens, we have large droplets that can be suspended once expelled, and typically those will fall very quickly to the ground. And so there's been recommendations about wearing masks and physical distancing, washing hands, cleaning surfaces. But there's more than happens than just these large droplets when you cough or you sneeze. There's also smaller droplets that are released, and we call these aerosols. So these are quite small. These are on the order of 5 microns. If you compare this to something that you can visually see, a strand of hair is about 70 to 90 microns, so very small. And these small aerosols can remain suspended in the air, which means that they can also start to disperse in spaces, indoors and outdoors. And then that can lead to airborne transmission of the virus that can be released from different individuals that are infected, asymptomatic, pre-symptomatic, or symptomatic. And so this is really what I'm excited to talk to you about today, about ways that we can address this aerosol transmission of the virus.
Wonderful. John Carl of the Connecticut Nonprofit Alliance has a question for you.
Hi, good morning. Sten, we've been talking about a lot of different methods. People talk about masks and social distancing, taking temperatures, etc. Can you talk about them a little in terms of their relative efficacy?
Sure. When SARS hit, the coronavirus that emerged from China in 2003, 2004, it affected Hong Kong very severely. It affected the city of Toronto very severely. But then it sort of died out because it wasn't as infectious person to person as the current novel coronavirus is. But we learned a lot, and it seems that mask use can give you at least 10% reduced risk. And if you wear a mask and everybody else wears a mask, that's probably multiplied. Hand washing is a very good strategy because we so often carry respiratory viruses on our hands to our face. And that's probably a 10 to 20% reduction as well. Physical distancing is possibly the most effective, and that can be maybe 25 to 30%, according to some of our transmission mathematical modelers. And then you've got avoiding groups, spending more of your time outdoors, where you get big dilutional effects. So you sort of add 10, 15% benefit, 10, 15% benefit, 20% benefit, 20% benefit, and you can really reduce your risk down radically if you're going to ventilate your home, stay outside as much as you can, ventilate your art venue, and Krystal will be talking about that in a moment, outdoor arts events, music events, mask requirements for all patrons, mask requirements for those performers who are able to use them. I think the violinists could use them. And ultimately, you're just whittling down the risk piece by piece by piece. But it takes kind of a social construct. We all have to care about protecting each other. I have to wear a mask because I don't want to infect somebody who's older than I am or who is more at risk than I am. And that kind of mentality needs to be inculcated in our patrons and in our staff.
Thank you, Sten. I think that's one of the things that we all know we need to spend a little bit more time on, is talking about how we in the community react to these, to our suggestions, so to speak. That could be one of our subjects, how we can help our audience help us with this. Judy Dworin of the Judy Dworin Project Incorporated has a question for you, Sten.
Sten, I'm going to ask about testing. Is the state ready to test everyone? And if so, how available and costly would it be to test large numbers of staff?
The state is making every effort to radically expand testing capacity, but no, they're not ready to test everybody. They're hoping to be able to get up to 40,000 tests a week, but they're not there yet. And it is true, however, that in partnership with some of the pharmacies, testing is far more available than it used to be. CVS pharmacies opened up, I think, 22 or 26 venues around the state where you can just drive through and get the test, and you pay $100, but it's a test that is valid if you think you might be infected. And one thing, we have a little bit of time because nobody's planning to open up their arts venues until July. We have a little bit of time, and could we test our performers and artists before we start rehearsals to ensure that nobody's an asymptomatic positive? The answer is yes, we could. It would cost us some money, but it would be very feasible. There's an underutilized testing center in the Satcham garage here at Yale, and people can drive through and get testing. So at the end of the day, it'll cost you some money. It'll be a little inconvenient. People don't like that nasopharyngeal swab down their nose, but it's a small price to pay to find out that you're not an asymptomatic carrier when you're starting your rehearsals for a particular event. It's also a reasonable thing when we're returning our staff back to work. if they are inherently going to have to work in crowded conditions, maybe that's this group of staff who should be tested before they come back. Other staff, if they're able to do masks and physically distance, it may not be so urgent to get a test.
Thank you, Sten.
By the way, can I add one more thing?
Sure, of course.
Don't confuse the virus test with the antibody test. Everything I've said is about the virus test, the so-called PCR. That's the test that tells you I have the virus now, and I'm infectious to others. The other test is the antibody test, and that just tells you I was infected in the past. And I could be a blood donor, and people could benefit from the antibodies that are in my blood, and maybe I can save somebody's life, or I know that I'm at less risk of acquiring the virus because I have already gotten it. But we're not using the antibody test very much. It's really the PCR virus test that we're talking about.
Great, thank you, Sten. Krystal, what are some engineering controls in our venues to mitigate risk for our patrons, artists, and staff?
So that's a good question that follows up on what was mentioned. So discussion about ventilation. So this is an example about an engineering control that we can apply to our buildings, venues, theaters, that can be used to lower the levels of potential aerosols that contain the virus that are present. So ideally, trying to introduce as much outside air as possible into your building spaces. So 100% outside air coming into your building and exhausting. So this would mean that you have dispersal of anyone that's potentially infected in your indoor space now being just released outside to mitigate the risk of exposure. So many cases, 100% outside air is just not feasible given the HVAC design of many building cases. This could be because it's been designed to recirculate, it's too cold outside, it's too hot outside, there's too much humidity in the air, and that could just cause negative impacts on the HVAC system. So in these cases, there are alternative ways that we can start ventilating. So we can introduce flush cycles. So before you have occupants come into your building, you can start ventilating on a higher amount of outdoor air for a shorter amount of time. So let's say 1 to 2 hours before occupants come in, you have this higher flush. Between performances, you could have a flush, and then also at the end of the day, flush as well. Maintain ventilation for extended periods, 24 hours, 7 days a week if possible, to just have that treatment of air continuously going. And another popular engineering control that can be applied is filtration. So if you're not able to have that high level of outdoor air come into your space, you can now start filtering your air and have all of those aerosols, which are airborne, now get deposited on your filter.
Great, so thank you, Krystal. So let's spend a little bit of time on ventilation and then on filters, so we really understand what we're doing here. So can you tell us a little bit more about in terms of ventilation and air exchange?
Right, so the way that we think about ventilation is how often are we changing the volume of air that we have in our building and replacing it with a fresh supply. And so this is really to reduce our exposure with any potential virus that is airborne. Because really, if we're trying to look at our risk for being infected, it comes down to two factors: the length of time that we're in contact with potential aerosol that contains the virus, and also the concentration of the aerosol that's in our virus. So now we don't want to start limiting our performance times, which would be one way to limit our exposure. So trying to reduce the concentration that we have within the air is ultimately one way that we can do it. So in that case, we will start increasing the ventilation rate, so having higher airflows going through building spaces. And this is where talking to a building engineer to see what your building space, your theater or venue can handle in terms of flushing out air, and also trying to think about other engineering controls that can be added to increase ventilation. So if the HVAC system is not possible at changing the air at a higher rate than what's set by current standards, then there's also some portable units that can be purchased and placed into the indoor spaces, like air purifiers that can also contain filters to help with that air exchange.
Great. Frank Trevera from the Palace Theater in Waterbury has a follow-up question. about
Thanks,
H.
Eric. Thanks, Krystal. Question for you is this: all the venues, and we have close to 200 people online. Many of the venues that we are looking at all have different HVAC systems. They also have different size and scope. For example, the Palace Theater's theater, we have 80-foot ceilings, so there's plenty of air to circulate. Perhaps a museum only has 20. A black box space has perhaps even less. Does the size of the venue, the ability to recirculate the air, make a difference? And what are some ways that we can kind of counter that depending on space and square footage that we have available to us?
Right, so this is all going to come down to the size of your HVAC system that you have in place, and the capacity for the air to be ventilated. So again, this is a conversation with building engineers to understand what is the airflow capacity that you have within your space, and strategies that you can use to increase the airflows within that space. And again, thinking about some creative solutions to that in terms of the amount of outdoor air that you can introduce in is one guidance that we've been recommending, and also the series of flush cycles to just have higher airflow at certain times in the day, perhaps when you have fewer occupants within the building. And then again, trying to introduce some of these more portable measures like air purifiers if your HVAC system can't handle the potential occupancy loads and the enhanced filtration and ventilation requires.
Great.
So does size matter? And I hate to be that guy, but does size, as far as the amount of square footage and space, does that make a difference?
Yes, so the ventilation required is going to also be determined by the volume of air within your space that you need to ventilate.
Excellent. And one more follow-up question from Darren Wood at Flock Theater.
Hi, and thank you all. A question about air conditioning units. Should we set our air conditioning units to recirculate? And how do we go about balancing the cost of an air conditioning unit with the importance of keeping the air quality safe?
Right, so that's an excellent point. So maintaining thermal comforts and decreasing thermal stress, that's important. So just turning off your AC units, that's not an option or a recommended option. So by having that extra ventilation supply, so not just recirculating, but also ventilating using some exhausts are recommended within there. And then also coupling that with some filtration units. So introducing air purifier units that have a filter incorporated, that will then allow you to maintain an AC unit operational within your facility.
Excellent. Judith McElhern from 5 Points Center for the Visual Arts in Torrington has a follow-up question for you.
Hi, Krystal. I have a question about artist maker spaces or studios like printmaking, darkroom studios that have ventilation as a necessity connected with them. Is there more that should be done or handled any differently than would normally be done?
Right, so these spaces pose a particular concern, and they would typically be higher ventilated to begin with. In these maker spaces, you have other particles that are being released into the air and other chemicals as well. So just paying attention that those ventilation rates are maintained, that's important. And then also introducing some additional air purification or outdoor air supply as much as possible would be recommended in these spaces.
Thank you.
So I think it's time we should move on to filters and talk about a little information about filters in the HVAC systems. Krystal?
Right, so there are a number of different filters that are available on the market, and many buildings will have some low-grade filters in place within their HVAC system. And these might not be as efficient as possible for capturing all of these aerosols that can contain virus. There are higher efficiency filters available. There are filters called HEPA filters or high efficiency particle filters that are very effective at removing these aerosols of the size that are typically released with viral material. They're effective on the order of 99.99% for the size of particle that we're talking about that can be used. There's also other types of filters that are labeled as MER filters. So these are minimum efficiency reporting value rated filters. And these are recommended by indoor standards, such as ASHRAE for incorporation within HVAC systems. A minimum of a MERV 13 filter is recommended. A MERV 14 rated filter is preferred, and these filters should be able to capture more than 80% of the airborne viral aerosols.
Excellent. And John Carl Casa has a follow-up question for you.
Very practical question. Do the filters need to be handled as if they're contaminated, or should they be just sort of left off and left alone for a few days before being handled?
That's an excellent point, because the purpose of us putting the filters in there is to capture virus-laden aerosol. We do have to be attentive to how we're handling this filter material. So ideally, you would shut off your system if it's not in use, and leave it for several days before removing the filter. In many cases, if you're operational with occupants present, you don't want to have your system turned off and your filter not being used. So it is possible to have a disinfectant that's sprayed. Doesn't need to be, but it can be applied, treating it as if it is contaminated. So wearing the proper personal protective equipment with a mask and gloves. It can then be removed, bagged, and then placed for general waste disposal.
Excellent. So, Krystal, I'm sure there's many documents and things out there that we should be looking at. Is there anything that you can share with us either today or later that we could get out to everybody to help us, especially those of us who maybe can't weed through a lot and want to water it down a little bit so that we can get right to the point?
Yes, of course. So there are guidelines that have been put forward by an organization called ASHRAE. This is the American Society of Heating, Refrigerating, and Air Conditioning Engineers. So specifically focused at these engineering controls in building spaces. And they have an incredibly comprehensive set of guidelines for non-residential, non-healthcare spaces that would be applicable to arts venues. I can send the links over for their COVID-specific related information. I have also summarized a lot of this information and added some other relevant features, and those summary can also be shared.
Excellent. Thank you. That's going to be so helpful for us all. Also, would you all use the chat box if you're a facility manager or someone who wants to get a little deeper into this conversation? We're getting the sense that we may even want to go deeper, so to speak, with this and have a meeting just for our facility managers and the folks who are on the ground working on this. So would you please let us know that either by email or sticking something in the chat with your email address in it? That'd be super. Sten and Krystal, I think we have a couple of questions that you may want to tag team on here for a little bit here. But the next question is coming from Rebecca Bayou from Lawrence Griswold Museum Online. Becky.
Thanks, Eric. So a question that I have is for those of us that are managing special collections such as art here at the museum, both in terms of those that is stored as well as those that are hung for exhibition. How do we strike the right balance between infusing more fresh air and a lot of these ventilation recommendations with temperature and relative humidity best practices that we have to follow for our collections?
I was conveniently on mute since I can't answer your question. I think the reality is that we're going to be looking at compromises between optimum art preservation and optimum risk reduction. So it may be that you cannot do quite the venting from the outside that Krystal has identified as optimum. You may have to do more indoor filtering, and either you can manipulate your filtration system the way that Krystal is suggesting. There might be better filters that could be used. You might increase the frequency with which there is air exchange. None of which would necessarily affect the temperature or the humidity that you're trying to optimize. There may be certain days where you can open the windows and other days where you can't. You're going to know more about that than I am, but based on ambient temperature and ambient humidity. And then one also has portable machines that won't break the bank, but might provide some additional air filtration assistance. If somebody like your building engineer says, look, it's unaffordable for us to do what would be optimal, let's do something that's better than we had before. But there is no magic answer to your question. If you need to maintain a certain caliber of temperature and humidity to preserve oil paintings or whatever it might be, then that's what you have to do. You're not going to sacrifice the integrity of your collection for the transient challenges of COVID until we get a treatment. But then I would work with somebody like Krystal to try to optimize, and your building engineers to optimize your filtration strategies. And by the way, Krystal, I'm skipping a lot of the questions on the Q&A that you can answer better than I. So if I'm talking and you don't have to pay attention, you can answer some of these questions.
Excellent.
I'm going to do through some of them now. There's some great ones in there.
Yeah.
Krystal, did you want to follow up anything on that question, or should we move along?
Right, so just to add to it, there's some elegant filtration solutions that can be applied if introduction of these higher efficiency filters can't be accommodated within your HVAC system. So there are ceiling mounted, portable, wall mounted air purification units that are able to then provide that treatment to your air to avoid the introduction of outside air. And all of those can be sized appropriate to your space.
Fantastic, thank you. Frank, back in Waterbury, could you take us to our next question?
Sure. Sten, you just said something interesting. You said break the bank. As you can imagine, there's not-for-profit organizations, both big and small, who are kind of grappling with all the challenges they face, maintaining humidity, maintaining airflow. What are some practical things that we can end up doing without breaking the bank or without being too luxurious in our kind of MERV filter 14, whatever? What's reasonable and practical that can we do as organizations to slowly implement these positive changes? And is there the Cadillac version, and then there is a more practical, reasonable version, and their effectiveness for our organizations, different sizes, etc.?
Great question. Maybe it's because I'm old, but I'm a big fan of fans. If you have a fan pointing towards a window and sucking air out, creating a kind of a negative pressure, you don't have the fan blowing at people. That's not what you have in mind, but you start aggressively air flowing outside the building. A fan does not cost a lot of money and can substantially, a good quality fan can substantially increase airflow. And that might be a cheap way of doing things. There are going to be days where you can open windows and days where that's impractical. I mean, if it's a cool day in December, you're not opening a lot of windows. But if it's a cool summer evening, yes, you might. So there are practical things, almost like how you would do it at home when you're trying to cut your energy bill at home. I've got the window open right now. I haven't put on my air conditioner or my heater where I am in my house for a month. I'm either opening the window or I'm closing the window. I'm either turning the fan on or turning it off. So there are those low-cost practical measures where you can increase the safety of your air quality without breaking the bank. The other part of it, I think, is to think about what kind of venue you have. If you're talking about a very small space in a in a museum where there's nothing very practical to do to increase the airflow, you could restrict the client flow. So you can have a little sign and say, please, 2 people maximum in this space at any given time. And what you're doing is you're practicing physical distancing instead of airflow, because you can't do much with the airflow. Palace Theater, you may have that phenomenon in your bathrooms, or you may have that phenomenon in a particular nook in the waiting area, or maybe where people are buying their popcorn, or, you know, so you may have to make those sorts of provisions as well. You may have to spread out where you're selling your refreshments to a broader part of the area. It's not as practical as having it all in one place, but you're practicing physical distancing. So remember that air quality, physical distancing, mask use, you know, avoiding crowds, washing surfaces, it's a package deal. And if you can do more with this, then maybe you can get away with doing less with that. And what you're trying to do is, on aggregate, improve the safety characteristics of your venue.
Krystal, do you want to tag in there?
No, I think that touches all on the main points. So outdoor air, a lot of these venues are in some very pristine places with some good air quality, and we can use that to our advantage in these cases and bring in that through open windows, open doors where possible. The box fan in the window, creating this negative pressure supply, that's a fantastic solution that's low cost.
Great, great. Judy Dwarin has another question. Change the direction a little bit here.
Yes, I wanted to ask you, Krystal, a little bit about UV lights. If you could talk about whether they're more effective than filters, are the claims that they make about mitigating mold legitimate, and just what should we think about them?
Great. So UV lights are another approach in the event where filtration is not feasible or is an alternative. And they've been used extensively within healthcare settings for specifically this application to reduce the concentration of infectious agents. And this would include SARS-CoV-2 in our current case. So yes, they can be used. Many of them do come at an increased cost when we are thinking about installation expenses, but they do work. There are different installations that can be used. So if you are looking at upgrading an HVAC system, a new installation, there are designs that can be placed within an upper part of the room so the lights are shining upwards. These are frequently used in hospitals. There are in-duct UV systems where you can have a higher intensity of light shining through for the airflow that's being offered. And then depending on the location of the theater, there's also coil cleaning systems where the lights are shining on the coils within the HVAC system that can be used.
Great, and let's try another direction here. Darren Wood, again, would you change the direction for us a little bit?
Sure. The question I've got is about electrostatic sprayers. And can you tell us just a little bit about what those are and how they're used for sanitizing, and or if both that and a UVC lighting system, especially in terms of disinfecting spaces between performances?
Right. So when we talked about the different modes of transmission, so we talked about larger droplets that can be released from when someone coughs or sneezes versus if someone's just breathing or talking and has these smaller aerosols with viral material being released. That really gets at different applications that we might get to for ways of reducing exposure. So the electrostatic sprayers are very good at disinfecting surfaces. And they have applicability that could be used between performances. In addition, I talked about flush cycles before between performances with outdoor air. If that's feasible, that can then start to get at what's in the air as opposed to just on the surfaces. The UVC lighting is then another approach that can also be dealt with for airborne presence within the virus. And then there's different applications that can be done there. But again, there's a higher cost that might be associated with the installation there.
Thank you, Krystal. We have a question from one of our folks out there, Dan McMahon from Goodspeed, but would like to know, he's been reading about putting air purifiers in bathrooms. Will that help even in lobby spaces that are not purified?
Right, so bathrooms are a really important location that have to be a part of the conversation when it comes to ventilation. So there's been guidance for making bathrooms touchless or contactless spaces, but also thinking about potential aerosol generation within these spaces is important. So increasing ventilation, so ensuring that your exhaust is functional, and ventilating the appropriate amount of air is important. Ensuring that there's a negative pressure supply within these spaces is also important as well.
So there's a follow-up question that may not be fair to put you on the spot, but I will anyway. Can you recommend an air purifier, and is it up to the quality of the filter?
Right, so there's two components to the air purifiers, and there's a huge number of them on the markets, and I talk about this in the air pollution class that I teach, and the students go through rating different types of air purifiers. So it's really now a nice application that we get to discuss this in many common spaces here. So these air purification units have different sizes of fans, so the amount of air that they move is different, and they also have different types of filters in place. So they will all be rated with a different filter that they use, and also the size of air that they move. So the more air that they're able to move, the more efficient that they are in terms of removing any potential viral containing aerosol through them. Each one of these units has a cadre, so corresponding to the volume of air that's being removed and the fraction of aerosol that is being released. So paying attention to this cadre rating for any of these air purification units will guide you to the appropriate size that should be used for the space that you're looking to place it in.
Great. So we want to move back to the system question. We've got a couple more here. My HVAC guy says that installing a very efficient filter will decrease airflow and could cause freeze up in air coils in the system. Do you think that's a concern?
Right. So any type of filter that's being applied within your airflow, you're effectively putting a block in place, and that can create a pressure drop within your line. So there has to be attention to what is the highest efficiency of filter that an HVAC system can accommodate. And that's why I suggested that there are these gold standard HEPA filters that block 99.9% of aerosols on there, but they create a really large block within that air path. And many times systems can't accommodate that. So thinking about what the appropriate filtration that can be used within your HVAC system is important, and that's a valid concern. And that's when we start looking at these alternatives. How can we supplement the filtration that's offered by the HVAC system with side units, like air purification units, and then also the UV systems, if financially that's a reasonable installation.
Great. And then we have several questions that come in the form of, how often do filters need to be changed?
Right, so there is no set recommendation for this, and that's the same practice for other conditions as well. So it's really just keeping an eye on what does the pressure drop look like across your filter by your building engineer, and then maintaining regular maintenance cycles. So if they're changed on a quarterly basis, potentially changing them in a higher cycle might be recommended, but there's no set recommendation right now from the different organizations.
Great. Beyond building engineers, who would be best to assess what facility needs in terms of ventilation and filtration? Do we go to an HVAC company, or do we go to a health department? Like what's our order of events here? How do we assess this?
So there are a number of organizations that are now making recommendations on reopening practices. The state is currently working on recommendations for building ventilation as well, and they will set appropriate guidelines that are COVID related. But of course, conversation with the building engineer who knows the system best and how it operates would be an essential part of that conversation.
Yeah, there's actually a follow-up on that from from Wesleyan Potters with all the clay that's used and the small particles in the air. And they actually have MERV 13 filters. They say, should they be replacing them more often? You know, how regular? What's the, you know, is there a way to get a precise change schedule when you're having all that in the air as well?
Right. So this comes down to all the other discussions that we have when you do have other activities that are expelling biological material like virus-containing aerosols or even chemicals. So maintaining that regular change cycle within your filters is important. Monitoring what your filter looks like in terms of what is the pressure drop across it. So what is that loading on your filter? That's important. And any of these activities, especially like clay generation with smaller particles, that will require a higher change cycle for the filters.
Yeah. So I know we're talking a lot about air. Sten, we have a question here that I find interesting that's right along there. Materials concerned with studio arts, especially reclaiming clay in ceramics. They reclaim and usually use buckets of wet clay that is recycled and recirculated to artists in the studio. What kind of concern should they have in that area?
Yeah, that's a tough one. The general principle for the arts is, even though you used to share everything before, see if you can segregate use going forward, at least until we're out of this next year or two, till we have good treatments. So let's say you've got a school event, summer event in July or August. You're bringing the school kids in. Rather than having them all share their colored pencils, maybe you'd make a little bit of an investment and give them their own pencils, and they would only use their own pencils. So the same general idea with the clay. If you can segregate the clay use to a very limited number of people, then that would, now if that's just not practical and you've got 20 potters and they're all using the same reused clay, then we're in trouble. But, you know, virus is not going to thrive in clay. And, you know, clay is the kind of thing where one might consider various ways of trying to, I don't think you can clean the clay. You can't really use UV light. I don't know the answer to your question, is a long way of saying. And I'm not sure. There might be some risk, but if the potter thoroughly washes their hands and then accesses the clay and is wearing a mask and doesn't touch their face and then restores that clay, and the next potter washes their hands thoroughly, wears a mask, one could theoretically keep risk in the clay to a bare minimum. But I'm not hugely self-confident in my answer.
Right. So many questions like that. I think we all want an answer, but there may not necessarily be any answer except for let's be really careful over the next until we solve this virus issue. Interesting questions about fogging, using fogging systems. Can consistent use of a fogging system cause residue? And the next part of that question, with another one asking, is any opinions on how to use hypochlorous hypochloric acid in indoor foggers, essentially using electrolyzed water? Any thoughts on that? I think I'm pointing to you, Krystal, on that question.
I'm not familiar with these fogging applications.
Okay. So maybe we should put that on the burner, and we'll do some research and try to come back with an answer about that. That sound like a good idea? So we'll get back to you on that. Sten, as you were reviewing these questions, was there any question that strikes that you feel we should address publicly? I know you're doing a great job over here answering many of them.
There was one, but I've answered 4 questions since then. Let me let me see what it was. Let's see here. Doggone it. I said I would like to answer it face to face, but I've lost it now.
There's a lot of questions in here.
Well, I've been trying to answer them as fast as I can. Can the person who asked the question, I said I wanted to answer it in person, just give me 3 words to remind me. Just send me a quick Q&A, and then we'll answer that question.
Okay, great.
Now, there is one that I'll take while I'm waiting, is performances. A choreographer or a director for dance or theater can certainly make some strategic modifications in the drama to try to manage physical distancing. Good luck doing that with Romeo and Juliet, where they're supposed to kiss and it's part of the drama and they're supposed to die together and all that. I'm saying there are going to be many circumstances in which reasonable physical distancing during dialogue or whatever would be reasonable. And I can imagine a creative director pivoting a play to the coronavirus era, and with a small dramatic modification, this is a play that's set in coronavirus and people are wearing masks. And you know, in terms of a choreographer being able to adjust a dance routine to create a little more physical distancing. But let's be honest, a dancer is breathing very, very, very hard. There is droplet aerosol. And my way of thinking is, if you can test the dancers before rehearsal, and they're doing the dancing or they're doing the play, and they're being very fastidious outside of the theater to physically distance and hand wash and mask and all the rest. You can tell people that all the performers have tested negative prior to this run. And you know, you're not promising that they're negative through the run, but you're saying we have made an unusual precaution to make sure that the performers are not infected as they have come in for this run. And you can keep the first 2 rows of the theater empty, so that when, you know, I've been spat on at the drama the way all of you have, and I love it. You know, it shows that they're really acting. But you know, I don't want to be spat on in coronavirus season. So maybe leaving those 2. You could even think about strategic plexiglass to reduce sort of the spitting that drama or dance might stimulate. We've been talking about that on the chat about flautists. You know, you've got the flute player, and you're not blowing your droplets through the instrument. I mean, it's going to be trapped in an oboe or clarinet or a trombone, but it's not going to be trapped in a flute. So then you might put the flutists a little segregated. Don't bury them in the wind section like you ordinarily would, but have them a bit segregated and perhaps behind plexiglass. You can explain to the audience why you're doing this. You explain to the flute players why you're doing this. So there are these practical sort of artistic compromises that you might consider. You know, I wonder if I might want to mount a one-woman play or mount Waiting for Godot with 2 people. You might make some artistic adjustments on your plans to tide us over this year of COVID until we get proper treatments and don't have to be so paranoid about it.
Stanley, it looks like the question was about performances and airflow, and I think you just answered that.
Oh, okay, good.
That question. We did have from our last wave of questions. What about face shields without cloth masks with physical distancing? Does that help?
Yes, it does. So the best mask, the sort of N95 caliber mask that we reserve for healthcare workers, because they're literally next to the coronavirus patient and they're all breathing the same air. So we like to reserve, given that shortage, we like to reserve those. However, surgical masks are no longer in shortage, and you can get some pretty good quality hobby masks. Woodworkers use them. Some potters might use them. That you can buy at the Home Depot, and you can make cloth masks. And the tighter the weave of the cloth, the better it's likely to catch droplets. And all of these masks are going to reduce your risk. And we don't have the intensity of exposure that a healthcare worker does. We don't need an N95 mask. So having a surgical mask or having a cloth mask is a terrific way for your droplets to be captured in your mask. So if you happen to be an asymptomatic carrier, you're going to have very efficient capture of droplets, and you're going to have some aerosols sneak out, but the volume of those aerosols is much less. And if everybody else wears a mask, then they're going to be protecting you. Now, masks do a better job protecting other people from the mask wearer than they do the mask wearer. So it's much more helpful if everybody's using it.
Yeah, absolutely. So Sten, I think I need to poke back to Krystal for a minute here. We have a question about moving air, again, from Joel Reynolds. Whoops, it just got away from me. Moving air is noisy. We're in the business of entertaining so people can hear. What is the quietest way to treat air beyond the HVAC system?
Great, so this is a real consideration, and when you have blowers that are moving large amounts of air, it's noisy. Like even when you're in your kitchen and you're using an exhaust, a lot of people don't like to turn on specifically for that reason. There's a really large hum, and the last thing you want is to be detracting from your performance because of the size of these units. So again, I go back to the use of these air purification units. Many of them are silent. And they can be installed to work in the space, depending on the size of the space that we're talking about. So that's a reasonable application that wouldn't detract from the performance. And again, if you can, any other creative solution you can have to bring in outdoor air passively, so not having to rely on a mechanical ventilation system, that can also be a noise-free solution.
A plexiglass follow-up question. Is plexiglass really necessary at bar tops and in between sinks and bathrooms, or is that overkill as people will be mingling once they walk away from these areas?
Well, I can give that a shot. There's close and there's close, and you have to use some judgment. I mean, I've been in restaurants where the two people using the sinks are having to literally brush against each other. They're so tight, you know. And it might be that you would take one of those sinks out of commission, and you would just not have people brushing against each other. The men in the audience have been in the urinals where there's a barrier between the urinals and places where there is no barrier. Well, it wouldn't be a terrible thing to have barriers. And so one has to try to be practical in regard. You know, one thing one can do is try to have a longer intermission and have a volunteer manage the flow in the restrooms so that you don't get the backlog. And one might also have a longer time before the performance. And guide your patrons and say, look, we welcome you to use the restroom before the performance. If your family surname is A through G, would you try to get here from 7 to 7:20? If it's H through N, could you try to get here from 7:20 to 7:40? And then you would handle your lobby completely differently from how you usually do. Usually keep the patrons out of the venue until you open it up for everybody. Well, what about if you opened it up early and you seated people so that you decompressed your lobby? These are the sorts of out-of-the-box thinking that we have to do. If we're talking about physical separation, how do we do that? How do we do that? By adjusting business as usual. And we're going to tell our patrons exactly what we're doing and why we're doing it. because we want to build consumer confidence. And if they hear that we're doing weird stuff and they don't understand it, and then we tell them why we're doing it, they go, well, thank you very much for protecting me. So I think that's, I mean, if I had one of your jobs, I would be thinking hard about how to use the public health precautions that you're taking as a sales pitch to your patrons, to your donors, to your members of your community, to say, oh my goodness, isn't the X Theater or the Y Dance Group or the Z Museum doing a marvelous job? Aren't they courteous, thinking about my health? That to me is where this consumer confidence piece needs to come in.
Absolutely. So I don't know where this hour went, but we've already tied up an hour here of folks. So before I go, I want to make sure that Sten and Krystal know how much we so much appreciate all that you are doing us. So I know there's a lot of hands clapping out there for you. So yeah, thank you for that. This art sector science-based guidance is just invaluable, and we appreciate this clarity and allowing us to put you on the spot for answers that we want and need now, but also know that some of these answers we're still really trying to figure out. So thank you for putting yourself into that position with us all. I just want us all to remember that, you know, this process is something that we're just barely scratching the surface of, and that together we can find a way to get, as Sten said just a minute ago, get our consumers to be confident to come back, and this will ensure your success, and I so hope that it will give us long-term viability for the arts sector as a whole. So, Sten, do we have a few more minutes that we can answer a couple more questions? Or
yeah, I pushed my 11 o'clock to 11:15, so I can, and I don't know if Krystal's available, but we can hang on for Q&A. Let the audience go and just hang on for people.
That would be great. Well, before most of you go, I just want to say again, thanks on behalf of Shoreline Arts Alliance, Yale Public Health, Yale School of Public Health, and the task force for being a part of this conversation. And we so hope you'll join us on June 24th at 10 o'clock for our next session. It's open. You can sign up now. So do so. So Sten, my questions moved on me here. There was a great question that I just wanted to ask you here. There's a lot of great questions, but where'd it go? Should we be sanitizing floors or only hand level surfaces?
Floors are not a big deal unless you're licking your shoe. I think standard floor practice. The problem is that what should be done with floors is often not done in the best of circumstances. I know that by going into public spaces and I look in the corners and they're dirty. So I would think that working with your cleaning staff to be especially fastidious with the floor cleaning protocols that they're supposed to be following anyway, so that it's clean at the beginning of the evening and then it's clean at the end of the evening. And I think that would be good enough.
Great. I haven't seen this question before. Are there special masks for kids?
Oh, I was just typing the answer to that one.
Oh, are you? Okay.
Yeah, I'll send it. Yeah, there are, and the manufacturers are making them, and we've had them in the hospital for years because the immunosuppressed kids have to wear the mask so they don't get maximum protection for them until their immune systems bounce back. You know, kids with cancer who have had bone marrow transplants, that sort of thing. So, and now there's a cottage industry of mask manufacturers, and they're making masks for kids, and they're often, with fun features like cartoon characters, to make it enjoyable for the kids to wear them. They can have some pride in them, that sort of thing. And it's not a bad idea to have sort of 4 or 5. If you're going to wear cloth masks, have 4 or 5 of them so that you can wash them every other day and dry them, and always have a clean mask available for when you're going out. And if somebody has been coughing up a storm, then immediately switch masks, take it off with the strings in the back or with the things. Don't touch the mask itself. The less you touch the mask, the better.
Great. Krystal, were you able to stay with us? We have a question for you. I know you, this is from Marcella Trowbridge at Art Farm in Middletown. Krystal, I know you resisted and understandably making specific air purifier recommendations, but as you and your students have done so much research, could you recommend a list based on this research be made available? Is that something we could provide them?
Yes, so there's so many different air purifiers on the market. All of them have this rating that I mentioned before, this clean air delivery rates that should be labeled on every box that you would consider purchasing. If it's not there, then it hasn't been rated. And what this rating gives, it's a measure of the cubic feet per minute of air that will pass through the unit. So trying to maximize that rating that you can accommodate within your budget, that's a number that you should be looking to judge which filter unit that you buy. They are also sized for different spaces. So consider the area of your indoor space and then consider that in terms of which unit you should be purchasing. It might also be recommended to buy multiple units if you have a larger space and putting them in the corners of the room just to make sure that you have good airflow within a larger space.
Great, thank you, Krystal. Back to our sanitizing floors, Sten. It's interesting. I think a lot of folks are suggesting that dancers' feet are like hands, in that they are often barefoot and often are rolling their bodies all around on the floors. So I think that once again, this is something that per art form, we need to think slightly differently based on what your use of the space is. But again, if you want to...
Well, but let's be realistic. You know, dance, it's going to be hard to physically distance. It's going to be hard to keep surfaces clean. Dance is inherently an integrated art form. And I think if you can test your dancers before rehearsal, I'm talking about events now, and if you got the money to test them all weekly, great. But if you don't, then test them before rehearsal and have them be fastidious about their comportment outside the theater. And if you know everybody's virus-free starting out, and they make an effort to be virus-free during the course of the events, then that may be the best you can manage. Now, in terms of dance studios for kids or people who are learning how to dance and they're coming every single week, then I would rely on physical distancing, I would rely on mask use, and I would rely on creative choreography to try to limit the extreme closeness that some dance pieces invite in a normal circumstance. And if we could avoid that, it would be prudent.
Great, thank you. We have several questions about seating. How often should we spray the seating down with some kind of a cleanser? How often? How much time do we need to have passed before we reseat people? Do you have some answers on how we should address?
Well, if you're talking about twice a day or every day performances, then spraying the seating down is not unreasonable. It would increase confidence. However, the real risky parts of the seating are the armrests. That's where the hands are going. The really risky part are not where your clothing is touching the cloth. That would be very, very low risk. So it depends upon how obsessive, compulsive, and fastidious you want to be. There's no harm in doing it, but I would be much keener on the back of the things where I'm holding it to go find my seat, so I don't fall. The armrests on each side of the armrest where the hands might go. That to me is the high yield. And by the way, if you're only having events on Friday and Saturday, and then the next Friday and Saturday, the virus is not going to live for 6 days on the kind of materials we're talking about. The rule of thumb is plastic and stainless steel about 3 days, cardboard about one day. We don't have good data on fabric, but it's probably not any more user friendly than plastic is. So this is not a very robust virus outside of the human host.
Great. Panel, task force members, if you have questions, just give me a wave in case there's something you'd like to put in there. I'm thrilled by this question. It's not really a question, but there are so many people that I know who would benefit from this conversation. Can I share this? Is there a way to share this recording of this webinar with them? And the answer is absolutely. It'll be running on our Facebook page, Shoreline at at Shoreline Arts Alliance Facebook page. It'll run there. In a few days, it'll also be up on our YouTube channel, but then it'll be really easy to share. So once we get that up, as we're making the announcements of the June 24th event, there will be a link also in that announcement. So absolutely, we want to share it. I love that. Matter of fact, this morning I got an email from somebody from North Carolina saying that they were wanting to sit in. Is that okay? I mean, we're lots of folks need this information. We're focused on Connecticut, but realistically, this is information for anyone around the country. So, anybody up in our panel have a question they want to get answered?
Well, I had one while people are thinking. Okay. The choirs. Choirs are a very unique circumstance because you're trained to project, right? I mean, that's what a good singer does. And even the kids who are not trained, they're kind of shouting. So the reality is you get much more distant droplet spread and aerosol spread than you do. So I can tell you what the Institute for Sacred Music is going to be doing at Yale. They're going to be having their choir concerts in the Battelle Chapel, and they're going to position their choristers throughout this big chapel, and they're going to use creative sound engineering to try to knit together the concentrated sound of a choir, and they're going to have it online. They're not going to have an audience. But one could also think about other strategies, and one could try to distribute choristers more physically distanced, have them singing in such a way that they're not projecting onto the audience or themselves. There are some creative approaches that one might contemplate. People are saying it's impossible to sing with masks, and I think that's probably true, but one might be able to sing with sort of a Butch Cassidy and Sundance Kid cloth mask that just sort of hangs over, because that would be expected to catch a lot of droplets and not inhibit the airflow and not compromise the breathing of the individual. So there are tricks that we're all going to have to experiment with and see if something makes sense.
Yeah, and along that same line, Krystal and I were talking last week about churches and how they themselves are, and you know, I hope you're okay with me saying this. There's a lot of performances that happen in churches, in gatherings like that. And Krystal, do you want to talk about how we have singers not only on stage but also or in the pulpit as well as in the audience? What a challenge that can be.
Right. So there are similar challenges and perhaps enhanced challenges that are faced when you have singing that occurs all around the venue space location.
We lost you for a minute, Krystal. Do you want to run back?
Can you repeat that, Krystal? We lost you.
Sorry, my internet connection is not performing. Oh, it's unstable. I'm sorry. Can you still hear me?
Yeah.
Well, we know you're in a developing country, Canada, isn't it?
So there are additional considerations, perhaps enhanced considerations that have to be taken when you have singing that's happening not from just the front of the house in the theater space, but all around the venue. And the best strategy for that, again, it's coming up with some creative solutions on how to best think about enhanced aerosol production.
Looks like we're having challenges with Krystal's
from a
Sten, do you want
larger
to?
number of individuals.
Oh. There we go. So we lost you again, Krystal, unfortunately. But in a nutshell, as a layman, what she shared with me was that we now have droplets going from lots of different directions, and it's an even bigger challenge. So we really need to keep our distance even more in the audience than we are than we typically might think in the congregation. Sorry to use the wrong term. So, Sten, do you want anything to add to that?
I will confess to having been typing my answers, and
Okay.
whenever Krystal answers, I'm typing.
All right,
Try to be
sounds
as
good.
efficient as we
So
can
sorry,
with this
I'm back
two-person
now.
team.
I apologize for that.
Okay. Want to give it another shot?
Okay, well, I don't know how much of it you heard what I said, but it raises some additional concerns about having singers all around the venue space and not just at the front of house. So the best way to accommodate the enhanced aerosol generation, that requires some more thought, and I don't necessarily have a solution for that, but just to alert that there are more concerns.
So Krystal and Sten, do either of you have any final word you want to give us today before we move on to our next session in a couple of weeks?
Thanks for inviting us. I'll just say the obvious. The arts, the museums, the family opportunities that you all present to us are a vital and vibrant part of being a human being alive in the great state of Connecticut. So we want to help you in any way we can, and we wish you all the best in forging these plans and staying afloat in this extremely difficult financial time.
Thank you, Sten. Thank you. Well,
bye. Gotta run.
Yeah, let's all say goodbye. Again,
Okay.
On behalf of Yale School of Public Health, Shoreline Arts Atlanta Task Force, we want to see you on the 24th. But don't think that we're sleeping between those the next 10 days or whatever that is. We want your comments. Make sure you send them our way. So again, thank you and have a great day. Together, I think we can reopen our arts venues with prudence and knowledge thanks to these folks. Have a super day. Talk to you soon.